Hi, this is Chris Coleman, and thanks for coming back for this edition of the Compliance Compass. If you remember, we talked recently last week about really, I would call this the physician contract life cycle. And we talked about the different components of that. And I had actually given you some homework. And one of those pieces of homework was around the literacy in your organization of Stark, anti-kickback, and the False Claims Act. And I said, what is your organization's understanding, especially those who are going to be doing contractual arrangements with physicians? And that one really ties in today, which is really what I call the first component, the first phase of the physician contract lifecycle. And that first phase is the agreement of terms. So we're going to take scenario A, is in which we're offering a contract to a physician that we're recruiting to our community, and we have come to the agreement of terms. But really, I want to backtrack and say, let's go a little bit before that and say, what about the offer of terms? This is why the literacy of Stark and anti-kickback and false claims becomes so important, because those who are actually on the front lines negotiating with a provider, with a physician, offering terms, that they must, absolutely must understand and have high literacy in the areas of physician compensation and the regulatory environment that governs that. Because how many of you have had this scenario? Someone comes to you and says, hey, we've come to agreement with this physician. Here's what we agreed to. And you go, no, I think that's illegal. We can't do that. And if not in the compliance world, certainly attorneys have come across this, as often they're the ones that have to construct these agreements and try to put an agreement together that it really codifies the terms that have been agreed to, but also make it legal. And so the reason I share that with you is because that's happened in other organizations that I've worked, where I'm presented with a contract that I'm like, you can't do this. This is paying for the volume or value of referrals. This is not fair market value, or so forth. It doesn't meet the test to pass the Stark law. And then the individual who negotiated that term says to you, well, I can't go back to that physician and take it back. And I'm like, well, you really don't have a choice. So when I tell you that, the literacy around these regulations is super, super important. They've got to understand really the landmines of physician compensation and how to avoid them, particularly in the terms. And some of the things that I've seen as well, how about paying a physician a bonus for the number of procedures they bring to the hospital? That's the volume and value referrals. Or how about if we pay the physician X amount of dollars because we know that if we pay him that, he or she will come? Well, that's way beyond fair market value. Or I've seen, let's offer this RVU value, this RVU, this rate, RVU rate, I should say, and we'll tier it. So if a physician does 5,000 RVUs, they get this rate. If they do 10,000, they get this. And if they do 15,000, it gets that. Now, I'm not saying that that's illegal. I'm not even pretending to be an attorney. That's my disclaimer. But the things that jump out in my mind is, well, how do you operationalize that? Maybe we can make that legal, but can we keep it legal? Huge, huge thing to consider. And just from a patient perspective, is the patient who is being seen that's producing the RVU at the 4,000 RVU level, is somehow that patient less valued than the patient that's seen at the 15,000 RVU? And do we create an incentive where the provider actually is trying to get to that level quicker by whatever means necessary so they can get the higher RVU rate? And even more so, is it retroactive? I've seen some of that. So when it comes to agreement to terms, it's actually the offer of terms that is the most critical in that space. And so that's why your attorneys have to be involved. That's why compliance has to be involved. And that's why the hard work of communication, education, and training and collaboration has to be done on the front end. Because to deconstruct or to pull back or claw back these terms, once they've been offered to and agreed to by your executive leadership and a provider, it doesn't feel good for anybody. The provider immediately is entering the relationship with, can I trust what I'm being told by this organization? And of course, it doesn't foster trust between the operations and compliance, because we end up being concerned about what is being offered out there. So when it comes to agreement of terms, number one, really educate, collaborate, work with executive leadership operations. Number two, make sure that they're highly literate in these particular areas of Stark, anti-kickback, and false claims, and come to an agreement of what can be offered and cannot be offered without compliance or legal input on the front end. We're not even talking about the construction of the agreement. Come to an agreement on what is okay to offer. And then if you stay within those guardrails, you will save yourself a lot of grief on the the back end, because as we all know, it is so much easier to prevent a misstep or a mistake than it is to claw it back. Thanks for tuning in to this edition. Next week, we're going to talk about actually constructing a physician compensation arrangement and the things that we need to think about in doing so. We'll see you then.